to start off, I served in the Air Force for 8 years as a special warfare operator, including multiple deployments to Iraq and Afghanistan, and extensive training and combat activities destroyed my knees. By the time I was 25 years old, I would hide a knee brace under my uniform so that other people wouldn't see me struggling, and I was taking anti-inflammatories and Tylenol on a daily basis just to get through and make mission. For me, I had already taken some time off of my knees to give them a chance to recover, and one day I did some sprints, and the next morning I woke up and I couldn't bend my knees. I was in excruciating pain. I could barely walk, and I had to go to the pharmacy and buy a cane around the corner just so I could move around and get to class that evening.
Right.
The next morning it was even worse, so I took myself to the ER, and that's when they said, go get an MRI, you have a problem. For many years I had no idea what was going on. I felt like I was being weak. Surely everybody else has the same knee pain. Do I have a lower tolerance for this type of thing? And to actually see the imagery and see that I was missing cartilage and the bone was grinding on bone, and that was the source of all my pain, it made me feel vindicated that it wasn't an illusion. I wasn't imagining this. So I had a bilateral procedure. And so from October through February, so I had my first procedure, the arthroscopy in October, my right knee in November, and then my left knee in February. The insurance company was difficult, to say the least, but My Cartilage Care is a group of patient support personnel, and one of them in particular worked with me. She was on the phone for hours, just navigating through the insurance process. Ultimately, I decided to go with my veterans benefits, and she was able to figure out how the proper coding works and stuff that's way over my head, but she helped me out immeasurably to get this procedure funded. Immediately after the surgery, there's some swelling that is unavoidable, and that was really painful. But it's a different type of pain, and it went away pretty quickly. The pain from my cartilage damage was gone. It was like a whole new me. It was already better than before the surgery, when I was still mid-recovery.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use: it is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information: MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at maci.com.